Dayna.
And I'm Ashley.
And this is The Black. Cute theme music.
Back. We're here. We're talking about stuff. We're doing things. We're drinking wine. I hope you're all drinking wine, but not while driving. You better not be listening to this while driving and drinking wine. That is a fair stipulation to make. I want to talk about something kind of important and rather poignant at this moment because I feel like every time I turn around, it's in my TikTok feed, it's in my Instagram, it's in my emails at this point. Dr. Leah, did you get a fun Dear Veterinarian letter from the FDA talking about Librela?
So, to be clear, the letter was from Zoetis, the manufacturer of Librela.
Not the FDA.
Not the FDA.
That's a fun distinction.
The FDA... okay, so the FDA...
Throat clear made that sound very serious.
The Dear Veterinarian letter was from Zoetis. In response...
The maker of Librela.
The manufacturer of Librela.
Yeah.
In response to an FDA statement about Librela.
Mm-hmm.
An FDA update. It wasn't like a recall. It wasn't a...
Well, it's normal for the FDA, though, to put out information as things get reported, right? Like, that's pretty much their job, actually.
A little, very brief history of Librela. So it was launched, I have the letter. So,
That's a lengthy-looking letter.
Well, it's on your phone.
It's true. It's always, it looks bigger.
So it was launched in Europe first, in 2021. And then it was launched in Canada, actually, before the United States.
Really? We did something first?
Yeah, that happens a lot if they're launched in Europe first. Because Health Canada is more likely to...
Where's that parvo vaccine? My parvo treatment. That's what I want now. Free to Health Canada and their slowness.
Health Canada is more likely to accept studies out of Europe than the FDA is.
Fair.
The FDA wants their own studies before they'll approve something, but Health Canada will take the European studies. So often, if it's approved in Europe first, then we get it in Canada a little faster than in the United States. But it's not really dependent on the company and their marketing schedule.
Right.
Right? It's like when they decide to apply to Health Canada to get it, or apply to the FDA to get it approved. Anyways, so it was in Europe first, and then only became available in North America in 2023. It's a relatively new drug on the market in the United States.
Especially for drugs. Like, drugs take a long time to age, right? Like, we see drugs that have been around for 10 plus years that are still in circulation.
This normal, regulatory cycle for animal medications anyway is that they go through a trial, like a US-based trial. They present that their safety studies or whatever. They have, again, for the FDA, they have to be US based.
They have to be?
Yeah.
So they won't accept a study that's been done anywhere else?
No, not the FDA.
Wow. All right. That's a choice. Fine. Is the FDA funding these studies?
No.
So they want someone to come up with the funds to okay. Somebody already paid for it, but let's also pay for it here.
Yes. So that's why the drug companies are strategic sometimes about these things, right? So they'll launch it somewhere where the regulatory bodies are not so strict, and then they have more safety data too.
Right.
Right? So then they can present that to the FDA.
Well, the US is also a huge market, right? Where you're also seeing that uptick in pet ownership where we're seeing them treated, better and better and better as the years go on, et cetera, right? Where we're going to pay for those drugs and we're going to do those things. So it's worth investing in that market.
Worth investing in the US market.
Yeah.
And sometimes that's why we don't get medications in Canada at all. Because they've decided it's not worth marketing and applying to Health Canada.
Rude.
To get them at all.
Rude.
Especially for things like heartworm.
We have heartworm medication.
Yeah, but there's some lots that are available in the US that aren't available in Canada at all.
That are better than what we have.
Well, there's Frontline.
I've heard about this. I have heard about this. It comes up every spring in my TikToks.
Yeah, but
does it have a lower risk of some of the things that people don't like about our current available medications?
It's a topical medication. medication.
I don't like that.
But it's like I don't want
safer
to
for our
it 'cause
cats?
it's not available. No.
See, that's the problem. That's why I don't like a topical. I immediately have a distrust.
Apparently, it's quite effective, especially against ticks.
I mean, so is when we.
Yeah. Yes. I mean, before we have.
In fairness, though, they have more variety of ticks in the U.S. too, though, than we have in Canada.
And like frontline, heartburn prevention, like frontline as a topical, is like very effective. I don't know a lot about frontline because it's not available here, but they are not seeking approval in Canada because there's not enough market.
We see it sold in pet stores in the States.
Yeah.
Which I also it makes me immediately distrusted.
Advantage.
I immediately distrust it. It have like an immediate distrust.
Wait,
Anyway, but they're not seeking approval in Canada because of the market, and so sometimes a lot of times, but yes, most companies are seeking to get into the U.S. market because it's huge, right?
Yeah.
But they launched in Europe. Sometimes some medications, like another good example is Metacam.
I love Metacam.
Metacam was available in Europe for a long time, and then it was available in Canada for a long time before it was.
What did the U.S.
available
use
in the
before
US.
Metacam?
Metacam is not the highest used anti-inflammatory drug in the United States
Really?
because it was not available.
I share your what?
what
Like,
are they using?
Like Rimadyl is way more
what a
popular.
ridiculously named medication.
Way more popular in the United States.
Immediately, you said Rimadyl, and I heard ribbed for her pleasure. Immediately. Did nobody else hear that? Was it just me?
It was just you. You should probably cut back on the wine.
Yeah. No, I'm telling you, Rimadyl, immediately I thought condoms.
There's this really nice drug called Zorbium.
Okay, that's hilarious.
I would like to get in Canada. Again, they're not seeking approval in Canada because it's not enough of a market. Anyway, long story short.
Is this the same two pharmaceutical companies, though, that we use for everything else?
Well, there's only a few.
There's
Animal.
two main ones. Like, are they the same? Like, they're the same makers of these drugs that they're just not bringing into this market?
Yeah. Well, so Boehringer,
Yeah.
Boehringer Ingelheim is a European-based company.
I assumed German.
I think German. Oh, Dutch, maybe?
Something of that variety of
European.
linguistics. Yep.
Anyways, that's a lot why their products are launched in Europe first. But then again, so they come to Canada next, especially if they already have manufacturing that's in French,
That's handy.
because that's a huge requirement here.
It is it's blocked a lot of things that I've gone to, like conferences, like trade shows for pet stores in the States, that I'm like, I must have this product, and I find out I can't get it because they don't have bilingual packaging.
It is
The bane of my existence. Although, fun fact, it's actually not required unless you're selling in Quebec for pet food and treats.
I think it's required by Health Canada for medications.
It probably is for medications, which is, I think, significantly more fair and reasonable.
Mhm.
But they still have to get, like, they have to do all the licensing to import products for consumption of animals into Canada, and that's not an easy process. But all that to say, yeah. So that was sort of my question. Is it still like all those products are like Boehringer, Ingelheim, and Zoetis? And then I'm like, well, you're already operating here. Like, just bring us the things. Except maybe not the topicals, because I don't.
So it costs them money. It costs all the companies money, right?
Which they charge to us. It's fine.
To go through all the stuff, the regulatory steps. So anyways, in the United States, they have to get FDA approval. So Librela, in 2023 was approved for the use in the United States. The thing with FDA approval and US use is that Americans think that they live
In a bubble?
on an island.
Yes.
And nobody else in the world has used this product.
Hey, America, P.S. Canada's attached to you. We're a different country, not your 51st state.
And the product is exactly the same. And the dogs in Europe and Canada
Are the same.
are the same. Anyway,
They're not special alien dogs.
they do their safety studies, they get approved by the FDA, it goes into use, and then there's this period of time where the FDA collects adverse event reports. Right?
Which is fair and reasonable.
This is the normal process for everything.
And we want them to do that,
Yeah.
in fairness.
So
We want
this-
that. That's a good thing.
This is how we learned about DCM and diets.
Listen to our nutrition podcast episode.
Because it was reported to the FDA enough times. So they collect all the adverse event reports once a product is on the market, and then after a certain amount of time, they'll put like an update
Right.
related to the adverse events.
Again, fair, reasonable. We want that.
Yeah, so the FDA put out their sort of update about Librela. I think it was in October, officially. Might have been November. No, I think it was October because the Dear Veterinarian letter came out in November, beginning of November. So they put out their update and reported some adverse events that were not necessarily highlighted at the beginning in the safety studies.
But we're in the safety studies, we're talking about a smaller pool, right? As opposed to the millions of animals that are on it now, right? Like,
and they count for Librela, they count it by dose given.
oh, okay.
Yeah.
Okay.
Yeah. They count their adverse events per dose, so not even like per animal. It's like per.
That's an
dose
interesting
given.
change.
Mhm.
Are we seeing that though? Is that coming? Where like you can give a couple doses and be fine, and then all of a sudden the 5th dose you have a problem? Like that feels unlikely.
It's pretty unlikely.
Yeah, like that's kind of a weird way to count it, I guess, for someone who doesn't do medical study for a living.
But because so Librela is sold as an individual dose.
Okay,
Vial,
right.
so they can track that really easily.
Well, that's
against
handy
predators,
then.
right? So they
Yeah.
can track like actually how many individual doses.
So it's not like when you take a bottle of pills home from your veterinarian, they don't count it as 60 pills, 60 doses. They're just counting it as one at that point.
One
I see.
prescription
Okay.
dispensed. But because it's administered directly by a veterinarian in a vet clinic, and it's also sold individually,
Right.
so they can easily track how many doses are given. So this update had some reports about neurologic side effects. So like ataxia, which is like weak and wobbly hind end, primarily. Some reports of seizures. Whether or not that's related to Librela,
It's hard to predict.
questionable.
My
And then
understanding
some
too is that a lot of those were seniors.
This is the whole thing. So some of these adverse event reports were blown up on social media.
By not the veterinarians or the companies, but by the pet parents.
Yes, by some.
To which 'tis your right, if you're listening to this. No judgment.
But it's
A little judgment.
It's proof that you shouldn't get your medical advice from social media.
Yes, let's start there.
So there are some Facebook groups dedicated to like Librela killed my dog. I mean, you could pretty much look up any product killed my dog, and you would find a group representing that.
So look, Taco is 19 years old. He's 19 years old. He is newly back on Librela. And to be clear, I took him off Librela just because I didn't think it was doing very much at the time. And we switched to Cartrophin, not because any other reason. And we're back on Librela now because we know more about Librela, and we now know you need to be on it longer term to kind of see the best results of it, which is fine. So we switched back. He's 19 years old. He could keel over tomorrow. I'm not going to be able to blame. He better not, just to be clear. Better fucking not. I will be very mad. But I'm not going to be able to blame Librela. Like he's 19 years old. A gust of wind could take him out at this point. Like it doesn't take, when you have a senior, you as a pet parent cannot possibly understand everything that's happening. Because while dogs, yes, are better than cats at telling us that there's something wrong, and, dog parents tend to maybe be more a little bit, hyper focused and treating them like children and paying attention to all of the little weird isms that dogs might present us with. At a senior age, that they can just get ataxia. Ataxia can come from anywhere, right? Like, you're not going to be able to blame one thing.
Well, and they also are at the end of their natural lives.
Not if I keep them medically alive forever.
Natural
So just
lives.
to interrupt for a second, is Librela, it's pain control, right? Is it an anti-inflammatory as well?
No.
Just
No.
pain control.
So
So
Librela-
Pain block.
Yeah, so Librela is an a monoclonal antibody. So it's injection, and so antibodies bind to nerve growth factor, which is a protein,
neurological thing that happens in your brain.
that is the pathway for pain, like the pain response to go to your brain. So that's what Librela does. It blocks pain. That's all it does, and it blocks specifically osteoarthritis pain. It's very, very specific. So
yeah.
So a lot of this, reports about is the case selection appropriate? Like if the dog already has some ataxia because it has a degenerative neuropathy,
a disc disease can also cause that. Yeah.
Other things that might cause it to already have, some ataxia and some weakness in the hind end, then Librela probably wasn't a good choice, because that's not what it's for. It's specifically for osteoarthritis pain relief.
And we should still be trying to address the inflammation that causes that pain, right? Like, we shouldn't be ignoring the fact that typically that type of nerve pain is also usually combined with some sort of inflammation. Not always, I would say, probably not, but it's the majority of the time.
It's that, that's what, like, osteoarthritis is an inflammatory condition. It's inflammation in the joints, and it's that chronic inflammation in the joints that causes, sort of the cartilage damage and the bone damage and the pain, that results in osteoarthritis.
I should have guessed that with the itis. Yeah.
It's an itis.
So is just one more question. Is osteoarthritis something that happens naturally in, like, pets towards the end of their life? Is that just like a symptom of old age? Or is it something that's experienced by all ages?
All the good questions from you tonight. Look at you go.
It can be experienced by all ages, especially dogs that have, we're talking specifically dogs. This is a dog-only drug.
Librela.
Yeah. So, dogs that have joint disease, cruciate injuries, hip dysplasia, elbow dysplasia, that have developmental orthopedic diseases that have, all of those diseases lead to osteoarthritis as they age, right?
It's just brought to my attention, Elton's going to have to keep an eye on that as he ages, even though he's only 3, because he had a developmental issue. And I wonder how his joints are going to progress as he ages. That's a good point. I'm going to write that down.
Obesity is also a huge risk factor.
He is not obese. He is just currently in a state where post-holiday...
He looks like a hibernating bear. He's fat.
But the other sort of term that we use for osteoarthritis is degenerative joint disease, right? So it's a chronic, progressive, degenerative, joint
Does this
condition.
apply to like an IBDD?
No, because IBDD is nerve. And it's
so it wouldn't work for something like that.
Well,
would it though? Because it's blocking that same pain receptor, wouldn't it?
Not necessarily. No, it's very, like, nerve growth factor is very specific.
Brain is a complicated place.
And, but with IBDD, there can be some osteoarthritic changes in the spine as well. So it's complicated, but
so, like, maybe, I guess, depending on where they were at with their hopefully post-surgical recovery.
But a lot of the problem, or a lot of the consequence of IBDD is the inflammation.
So we'd be better off with an NSAID.
Yeah. And that's why we used to treat IBDD mostly with steroids, because we needed a potent anti-inflammatory. But now we've learned that that's really probably not the best, that the non-steroidal anti-inflammatories do a good job of that kind of anti-inflammatory.
It's IBDD scares the shit out of me because I have Chihuahuas and French Bulldogs. It's just in my future. We just don't know where. It's like a fun roulette of, like, when's it going to hit?
Obesity.
None of my animals are obese. Elton is going through a current larger sea cucumber-ish phase that we are going to... He is on a nutritionally... I did not write this diet. This was written by a veterinary nutritionist, and it just needs to be adjusted. I did not do this, and I refuse to accept responsibility for his current shape and size.
So there's so many different factors with osteoarthritis and, pain and degenerative joint disease in dogs as they age. So, like, you've got like just their muscle mass and activity and how fit are they.
Yep.
And then
Well, I've seen some really like the heavy agility dogs, right, who are super in shape, still come out with arthritis at the end because their joints, you're hard on them doing agility, which is just like us, as if you run a lot, your knees are at some point gonna crap out. And the muscle mass, like they're really heavy, right? Like muscle is heavy.
and lots of dogs as they age, their muscle mass reduces quite a bit, right?
Yeah.
So they have a lot reduced muscle mass and they have less strength. So then they maybe have ataxia because of that. Some weakness associated with it. Like lots of people, as their pet ages, as their dog ages, when they come to me, they're like, oh, he's shaking, especially when he tries to poop.
Well,
Right?
it's just his muscles aren't that great.
Yeah,
He's having a hard time.
He's got probably some hips and he's got reduced muscle mass, and then they start to like shake and become weak in the hind end, and that's not because of Librela.
No.
That's
Because they're
normal.
old. You try to poop without sitting on the toilet and see how much you shake. I'm just saying. Don't do that. It's going to end up with poop on your floor because you will fail. But like,
He'll stand up.
yeah. Because your knees are going to give out.
But so that's
Oh, that was a bad thing to say. People are going to do that now and tag us, and it's going to be terrible.
As long as they don't send
You
pictures.
know what? Fine. My phone's already full of poop pictures. Whatever. It's fine.
So yeah, I mean, when Librela was launched, at least in Canada, they specifically market it as like multimodal pain control. This is something to use in addition to weight control, disease modifying medications like glucosamine and chondroitin and green lipped muscle. Did I mention weight loss already?
Yes.
And
Love it.
anti-inflammatories.
Yep.
So all your NSAID class of drugs. And then, Librela, and then the cat equivalent to Silencia have a real place in animals that cannot get anti-inflammatories for some reason, right? There's a lot of, contraindications to anti-inflammatory drugs, kidney disease, liver disease.
So Silencia being the cat version of Librela. Yeah. So same vibe.
Principle.
Yeah,
Works
a
the
little
same
different.
way.
Yeah, same monoclonal antibody treatment, but is specifically designed for cats.
And so in cats, it's had a huge uptake because so many older cats have kidney disease.
So many cats are fat
And cats have arthritis and they don't show you because cats don't show you anything.
till they're dead.
But
That's how they get you. That's how cats get you. I'm just saying.
um,
They are the
but
masters.
So many
of
old cats
surprise.
have some variety of kidney disease. They can't take anti-inflammatory drugs because of that.
So can cats not have Medicaid?
Not if they have kidney disease. It's a huge contraindication.
So as soon as kidney disease is present, we can't do any NSAIDs.
we don't recommend it. It's a risk. It's a
Intrigue.
risk. There's sometimes the benefit outweighs the risk, but with a drug like Silencia has pretty much eliminated that because Silencia does not.
So we just don't have to take the risk anymore.
You don't have to take the risk.
I love it.
Silencia instead.
Well, Squid, that's what's in your future if you don't get on your freaking cat wheel that I bought you.
Stop eating all the treats.
Yes.
He steals your sister's foods. I'm actually buying them, the microchip feeders that you can get. So, like, only they're microchip. Well, I'm buying them those because I'm pretty convinced that she actually just eats everyone else's food. But
I love those
because
feeders.
Shrimp's weight loss plan went beautifully. She looks great. Even Leah said she looked great. But Squid is still a porker. She got a ways to go. And she won't get on her wheel. I bought her one of those cat wheels. She looks at it and just like, Like I had the audacity to place it in her house. Audacity. Like it's just, like if looks could kill, I would be so dead.
Aww.
So that's what's in her future.
But anyways, I'm going to read the stats. So this is in the Dear Veterinarian.
Oh, they send statistics. I love
They
it.
sent some stats about the adverse events.
Love it.
Again, this came from the company.
From Zoetis.
From Zoetis.
I feel like they're monitoring that though. It should be accurate.
So the Dear Veterinarian letter was from Zoetis to reassure members of the veterinary team about the safety. It's valid. It's good information. So since its launch in Europe first in 2021, over 21.3 million doses of Librela have been given.
That is a
Globally.
lot. A lot.
21 million.
21 million.
And then they talk about Canada. So in Canada, we have the same sort of system, is that the adverse events are reported to the Veterinary Drug Directorate, which is part of Health Canada. And they do the same thing as the FDA. Well, they'll monitor, safety and adverse events. We just tend not to get so hyped up about it.
We're very reasonable people.
Mostly.
Some of us.
So based on our continuous monitoring and evaluation, the adverse event signs continue to be rarely reported. So less than 10 adverse events, all adverse events, per 10,000 dogs treated. And there's been a decreasing trend in the number of adverse events reported, while distribution of the drug increases around the world.
Is that too because the veterinarians are being provided more information about the prescription, like when to prescribe, right? Because that's valid as well, right?
Sort of like, veterinary, like case selection is important. In some of their marketing materials, they recommend, so there's this like a scoring system. They recommend using this like standard, this COAST guidelines,
So
which is the Canine Osteoarthritis Score Test.
That would spell coast.
COAST. Anyway, the COAST scoring system, where it's like a standardized scoring system based on the dog's gait and its weight. Anyways, it has a bunch of different
Its gait
things.
is an interesting factor.
Yeah, so like how it's walking and different how.
So even if it's a
getting
normal
up,
weight that's
getting-
walking, because the ataxia.
Mm-hmm. So
I was like, why is that relevant? Ataxia.
If they're like COAST score, it's out of 5. So if they're like COAST score 2, maybe you start an anti-inflammatory.
So a 0 is ideal.
0 is ideal.
Right.
Right.
So it's not like a weight score where like the middle is ideal. This is
No.
like you want a 0
This is-
on the
yeah.
scale. Okay.
Yeah, this is like their scale of arthritis.
Right.
Their
Interesting.
stage. And then
How
so
does
then at 2 you start like an anti-inflammatory, and then maybe at like 4 you start Librela.
So as a veterinarian, how do you assess osteoarthritis? Like, do we do an x-ray? Is it a physical exam? Is it both? Like, how do we determine that an animal has arthritis?
So the gold standard is.
I love that came with air quotes. Gold standard.
The gold standard
I love it.
to diagnose osteoarthritis would be X-ray.
So it does show on an x-ray.
Does show on X-ray. Yeah,
That's
it does, shows bone changes on X-ray.
okay. But you can also maybe assess it in a physical?
Yes.
If a client's
But
like,
it's
I don't have the money for x-rays.
Yeah, X-ray changes don't always correlate with clinical signs.
Like clinical signs could present earlier.
Yes, definitely.
Okay.
And also your X-rays can sometimes look terrible, but the dog walks
Fair.
fine. It can be very, like, it doesn't always correlate, but so yes, we have to put it together. So your X-ray changes along with their movement.
There's multiple pieces of the puzzle.
Mhm.
You need to kind of have, ideally, all of them to make a decision.
Yeah.
Now, let's say my dog doesn't have arthritis, but we think it does, and I give it Librela. Does it matter?
It doesn't matter. It's probably not necessary.
But let's say, for example, I think we have clinical signs, the vet thinks we have clinical signs, and I give the Librela.
Is it gonna make
Does it hurt anything?
No.
So you're better off to say, my dog, like the veterinarian says, looks like we have clinical signs. The patient says, I really can't afford x-rays.
Which is
Can-
most of the time.
It happens a lot. Yeah. Can we just go ahead with the Librela? The answer being, yeah, it's fine.
Yeah, I mean, for me, if it was sort of a middle-aged dog, you think, your dog's starting to show some signs of stiffness. They're having trouble jumping onto the bed, having trouble getting into the car.
Stairs.
They're having trouble on the stairs. They're doing maybe some shaking in the back end.
They change the way they go up the stairs.
Yeah, they're bunny hopping.
Yeah.
Or things like that. Then, honestly, my first line would be, let's do it like a Metacam trial.
Yeah.
Because we can give Metacam for 1 week. If it does nothing, then it's probably not. It's not arthritis pain.
Yeah. Well, and we have a great example of
And we
this.
can take it away. So that's the thing with any injectable medication that lasts a long time, like Librela lasts a month. If you experience side effects, we cannot stop that medication.
Yeah. Because you're stuck with it for the 4 weeks that
You're
it's in the
stuck with
system.
it for the 4 weeks.
We have a good example of this because I recently brought you one of my bulldogs thinking well, actually, worst case, I thought you were going to tell me she had early signs of IBDD, which we've talked about a lot for the record is intervertebral disc disease. Did I say that right? Intervertebral. It's a real tongue twister. Which is why we say IBDD and not the long way. I was convinced because she started bunny hopping when she went up the stairs. And she has a really weird gait. She always has. She's a bulldog, so she's already just not normal. But combined with the fact that she's changed the way she started to go up the stairs, I was kind of worried about worst case, because she's a bulldog, that she might be starting IBDD. But luckily, we were able to pay for the x-rays, and we sedated the shit out of her because she's kind of a dick. And you were able to fully assess. Well, she is.
I just love that you tell people
She's
that.
trusted by Leah all the time.
Although I learned that she's great.
Sedated.
It's lovely patient. When you get some pre-visit pharmaceuticals.
Yeah. So, you were able to fully assess her. There's no osteoarthritis buildup. There was, thank God, no IBDD. But that was my first sort of potentially clinical sign that maybe we had something going on here, painful or otherwise, that we needed to have investigated. And at that point, I would have been happy if the answer was she has arthritis and we need to give her Librela over the IVDD. But, we got lucky and there was nothing there. But that's a good example of, we were looking at her kind of changing the way she does things. And she is like 7 years old at this point, which for a bulldog could be a senior, could be middle-aged. You never really know with them. But we got lucky. Turns out the secret was drugs, though. If we drug her, she's actually lovely.
She's lovely. Okay, I looked it up. It's the canine osteoarthritis scoring tool.
Oh, you were close.
Staging.
Scoring test, scoring tool, same.
Staging tool. Anyway.
Staging tool. Whatever. Same.
Whatever.
I give you full points for that. That was pretty friggin' close.
Anyways, the sort of the point is that Librela is another tool,
not a singular tool.
To be used like in our spectrum of things that we can do to help our older dogs or younger dogs with arthritis live,
longer, happier, pain-free lives.
Quality of life.
Yeah.
Because it really does help their pain. A lot of people think that some of these adverse effects that have been reported are because the dogs actually feel so good and then they're overactive.
That's a very fair. And you know what, though? How would you assess it? Like, how would we even break that down? Like, you would have to have some.
Client tell you, like, oh, he felt so good, and then we played fetch for like an hour. He hasn't done that in 2 years. And you're like, oh, that was
maybe we don't do that. Yeah, that was a dumb idea. But
now he's just exhausted.
It's funny because there was a period of time, and I think it was primarily over the pandemic, where I had clients, actually we still do it. Clients will come in, they're on a raw diet. Sometimes it's not a brand I sell, and I will usually try to convert them immediately because if I don't sell it, there's a reason. Usually. Sometimes not. Sometimes it's just I don't have room in my freezer, but most of the time there's a reason I don't sell it. And they would come in and they would tell me they're raw feeding, and I would kind of cringe a little until they told me more. And I would try to convert them. But I would say, well, what, we talk about how'd your veterinarian feel about that? Because I'm always looking for like raw, comfortable, not raw, pro-raw, because that's needle in a haystack, but like a raw, comfortable veterinarian. And 90% of the people I talk to, and that's not a made up statistics, I counted one day and wrote it all down and did the math, lied to their veterinarians about it.
What?
No joke. They would literally tell their veterinarians they were feeding Royal Canin, and veterinarians, as soon as they hear Royal Canins, ask no further questions. So it's like, great, fantastic, write it down, move on. Which is a whole problem in and of itself. We can circle back to on another episode. But I think this is one of the reasons that you don't want to lie to the veterinarians. You want to tell them the truth. Because if something like this happens, right, and the answer simply was that you exercised what could very well be described as poor judgment and exercised your arthritic dog in the backyard for 2 hours while throwing frisbee, and you realized after the fact that was probably a bad idea, so you got scared and lied to the veterinarian. This is what causes us to be delayed in finding some of these adverse effects, right? Because they're not getting reported the way that they should be. So take anything away, it's tell your veterinarian the truth. Whether it's your food, whether it's your exercise habits, if you truly have a fat dog and you're sitting on the couch all day, don't tell them you're walking them twice a day. First of all, they don't believe you. So just stop right there, because they're not going to believe that. And secondly, they're not judging you. They're just trying to make the best decision for your pet in that moment. They're trying to help you. They're on your side. They're on your team. They're on team dog. Well, not your team, because you're a person, but they are on team dog. And unfortunately, you're the one with the credit card. So they're kind of on your side too. But I stand by, tell them the truth and let them help you formulate a plan, whether that's okay. Lesson learned, Librela is not for you because you're not going to think this through very well. We need to go back to, maybe it's general NSAIDs or some other protocol.
Like a gradual return to like normal activity. Like, and it's great that your dog felt so great, but like
slow it down. Yeah. Maybe like a gentle walk would be nice.
Like, let's build up playing fetch in the backyard again.
Yeah, like maybe that was just a bad idea. But the point stands. I tell them the truth, right? And look, as a raw feeder myself, I do it too. I walk into vets clinics that are not my own. And, she would like attention now. She's decided you're no longer the enemy. Yeah. You probably can't hear her. Maybe you can't hear her snoring.
2 hours, and now she's decided
she would like uppies. She wants you to pick her up. That's what she wants. There you go. That's what she wanted. She's decided now that, she wants cookies.
Oh, no.
Yes. She has decided you are a friend now. Look at this is all it was, took with some drugs.
Yeah, I know.
And it wasn't. Okay. Yeah. She's decided. We put nose balm on her last night because she's getting really crispy. But anyways, all that to say, tell them the truth. I've walked into vets and felt like uncomfortable telling the veterinarian that I feed a raw diet. Like I say it really like carefully, as if the words are poison. And you know what? Most of the time they're fine. They might have some questions, which is fair. If you walk into my store and tell me the same thing, I too have questions. And I immediately distrust everything you say until I can verify otherwise. So just be honest about their exercise, about their pain levels, about the symptoms you're seeing. And, whenever I put my pet on a new medication, no matter what it is, I write things down. I'm not going to remember 6 months later when I go in for a follow-up what they were like afterwards. And I didn't do that with Taco when we first went on Librela, and I regretted it because when we went back in and I said, you know what, I don't think we're seeing anything. He went, well, when do you think you stopped seeing something? And I went, you know what, I don't know. And that wasn't helpful.
I've heard from a few clients that they didn't think the Librela was helping that much, and then they stopped it and realized it made a big difference.
See, we switched to the Cartrophin, and I actually do think the Cartrophin helped differently because it's a certain type of. It did, yeah. But then I also felt like we plateaued with the Cartrophin. And then, you and I had a conversation offline about just, he's 19 years old. You might just have to expect what it is. But now we know more about Librela and how it interacts with the dogs. And so we've decided to try it again. And he does his twice a day little promenades around our house, but he doesn't do much. So she likes you now. Look at this. This is crazy.
She's trying to get comfortable.
She likes you.
One thing to remember with all the monoclonal antibodies, so, that's Librela, Silencia, Cytopoint, all of that sort of new group of medications is that they do take multiple doses to see the most effect.
Yeah, which I think is something I lost patience for, and I probably should have stuck with it longer. But, again, he's 19. He doesn't move much, so.
Well, there's only so much you can do.
Yeah. Well, and he's not allowed to do our stairs because he only has one eyeball and the one that he has left doesn't work. So he's not allowed to do much other than promenade around our house, on the main floor. And then we bring him up to bed at night. But, yeah, I'm giving it another go. And I have to say, again, 19 years old, I'm not seeing any adverse effects whatsoever. But I can tell you it is all over my TikTok about certainly some of the independent stores that I follow on TikTok are saying I've been telling clients about this for years not to give it, which is weird because you work in retail. So stop telling people not to do drugs, those types of drugs.
Also, can you say you've been telling customers not to give it for years when it only came out in 20?
People exaggerate. It just mean they've been telling them to never give it. They've always been saying don't give it.
Liars.
Which is weird. because like you don't work in that sphere, so like why are you making that recommendation? But whatever, like I have not seen any adverse effects, and I have lots of clients who are also on it, and lots of family and friends who are on it, and they're not seeing any issues. And now I do have family whose pets are only on Librela; they're not combining it with other medications. And since this has come out, we've had a conversation about making an appointment to talk about other stuff. But
yeah, I mean, and there's some instances where that's probably appropriate, but it's
yeah. But the advice is don't take the advice off TikTok. Make an appointment, talk to the veterinarian. And like, because people do, I mean, we saw it in the last podcast episode. Literally, while we were recording, I got a text of someone who was like, "What does this look like, and what do I do?" I get them all the time, and my response is usually like, "Well, here's what I know right now about this, but you should probably make an appointment and talk about these things," or whatever the case may be. Because even if the vet turned around and said, "Yeah, you know what? Librela only is fine in this particular case," great. You got a wellness exam and you're good to go. And if you're on insurance, tick, done for the year. I'm just saying.
well, and
Trupanion won't leave me alone.
and
Due for an exam every 2 minutes because I have 19 dogs.
And counting.
Well, yeah. Well, so it's funny because I messaged our vet and said, you know, I'm getting this message for Elton. Elton's due for an exam. Elton has been seen by 18 veterinarians this year alone. Like, there's no freaking way, if he's not due for vaccines, that I am booking him for an annual. Like, no. So I texted my vet, because the vet clinic staff, of course, did their job, and they're like, no, you have to book an appointment. So I texted my vet, because he's also a friend, and I was like, can we please just sign off that he had a physical? Like, you saw him 6 weeks ago for something else. He's not due for vaccines. Can we just mark this as done? And he was like, yeah, I saw him like 5 times this year. And I'm like, I know.
definitely up to date.
Yeah, he's fine. And he wasn't due for vaccines. He's due for vaccines next year, so he'll have to go do those. And because he's so small, we do them in 2 appointments because he's like, well, now he's probably 5 pounds. But he's typically only 4 pounds. He's just going through a little trunk phase. But the insurance companies want him done every year. They all want them all done every year, which is valid and fair. You should see your vet every year. But yeah, anyways, Potamus is due, but he's going in for a dental in February. And I'm like, I'll just do it all together then. Like, he'll have to go for a pre-op appointment because he'll definitely need antibiotics because his mouth is disgusting. We're going to have to take a pool of how many teeth he's going to lose.
All of them.
Yeah. Like, he's one of those genetic nightmares that it doesn't matter what you do. He's just disgusting. And I think we're going to have to
getting a blue hustler. / teacup Great Dane.
Do you feel worse for him when he doesn't have any teeth and then he can hustle you out of more things?
I would be more likely to share French fries with him if he doesn't have teeth.
Oh, you don't share French fries with anybody.
I know. Big word.
Blue hustler. I swear they must have thought blue healer, but I'm like, he's a chihuahua. Like, how did you think blue healer? Also, like,
That's not how they look. Yeah, how do you think a blue healer looks?
Well, I'm also like, how do you know what a blue healer is, but not a chihuahua? I mean, she obviously didn't know because she called it a blue hustler, but whatever. The teacup Great Dane, I get it, because he just looks like a very, like somebody put the Great Dane in the dryer for too long.
Really cool.
And now he's just small. But so when I rescued him, he was a rescue. He came up from Tennessee. I flew down and back to get him. Same day. Literally called my husband on the airport and was like, going to pick up a chihuahua in the States. Can't be back later. Bye.
Don't ask questions. Love you. Bye.
Like, booked a flight, went down, picked him up, flew back. I brought him in the next day for a vet appointment because, I don't know, America. And the vet tech came running into the room, scared the shit out of me because when vet techs run, it's scary. Okay? They are calm and composed people. This vet tech came running into the room with a video of the ear mites she had pulled from his ear that were in the microscope. She is like, I've never seen this. She was so excited. She just had to show me how many ear mites. And I'm like, both disgusted and thrilled. That's all it was. But she's like, and they're crawling around. It was disgusting. But I'm like, well, that explains why one ear was floppy and one ear was up. Yeah, that's Potamus. He's crazy. He is a Chihuahua, not a Great Dane that has been shrunk in the dryer, and not a Blue Hustler, whatever the hell that is.
Let's circle back to Librela for a second. I don't know anything about it. Like, this is the first I'm hearing about this Librela issue, but
how is your Facebook feed not blowing up with Librela problems?
I'm only on Facebook for rescue purposes. My feed is very curated. It's literally just recipes and sit with me and crochet. That's
that
it.
Does explain why you make the best food.
Yeah. But is the dosing, you said Librela is injectable, so is the dosing like proportional to the size of the dog? Like, is it based on weight, kind of like Cytopoint is?
Yep. Yeah, it's like exactly like Cytopoint is. So it's like, and like I said, it's individual vials.
I have a vial. Do you want to see it?
So like,
so there's like, I think, like, I can't remember off the top of my head, but anyways, there's a lowest, minimum weight, and then there's a max. Well, you can combine vials up to, like, there's really no maximum because you can combine, although the cost of that would be insane. But yeah, so basically it's like there's like a range. Oh yeah, there you go. See? Oh, this is the little tiny one. So yeah, so this is like the, where are we? 5 to 10 kilograms.
Okay.
Yeah, there's a couple.
And there's only French is like, this is for me.
single dose, but because it's not it's sterile, it's injected, and there's no preservatives in it. So
we only get one at a time. So like next month I have to go back and get the February dose.
Yeah, so you can't like split it or divide the dose or anything like that because there's no like preservative in it. So you just,
which is probably good. That sounds like a good thing.
Well, I think it would you'd probably have more adverse events because they're probably related to the preservative more than anything. And I think it would damage the antibody.
Yeah, well, I mean, the monoclonal antibody thing sounds new, right? Because we really only started hearing about it in mass over the pandemic because that's what the new COVID vaccines were, was the monoclonal antibodies. And so I think that's when we started as general populace hearing about those types of vaccines and those types of treatments. But they've been around for a really long time. And they're well researched. The monoclonal antibody treatment in general is well researched. I think a lot of these drugs we're 10 plus years into research.
A lot of the application is the same in humans, right? For
I should put that back in the fridge.
Rheumatoid arthritis, which is, I think, where the technology from Librela comes from. I could be wrong on that. But yeah, so a lot of the, but because it's an antibody, it's like very species specific. Like if you gave the cat version to a dog, it wouldn't work because the just going to break it down. Because it's like a foreign substance.
Right. And so, like, if, say, Remy I had a conversation with my vet, we decided Librela was, like, the best thing for Remy. Would I have to go in every 4 weeks for the injection? Or do you ever get to a point where, like, you as a pet parent would feel comfortable injecting it? Like, how does that work for long-term use?
And so the recommendation from the company is that it's administered by a veterinary professional in the clinic.
Judge me not that I have it at home.
Couple of reasons for that. So the biggest one is that there's a risk of human abortion.
Oh. Well, I'm not having any babies.
Yeah. So if you're at risk of being pregnant, you should not handle
with contact.
You have to inject it.
Like if you accidentally poked yourself. Okay, well, if you're going to accidentally poke yourself, you shouldn't be giving things at home anyway.
Well, that's exactly.
Dayna, do you know how many cat clients of ours told me that they had accidentally injected themselves with insulin while trying to give it to their cats? Like, it's
that's terrifying. That could kill you.
Yeah, so that's it. That's the huge risk. They don't even recommend that. Like the vet techs, if you have a pregnant vet tech, they do not give those injections.
Well,
there's a risk.
Look, animals are moving targets, right? They move. You poke.
Needle stick, yeah.
It can happen.
But the other big reason that the company does not advocate for that is handling and storage, right? It has to be refrigerated, you know, to be like drawn up properly, sterilely, you know, if you're injecting
Switch needles.
You know, so we do give it out to clients. We make them sign a waiver that lays those things out. And we also say, like, if you mess this up
It's on
and
you.
squirt it all over your floor, that's your $100 that you've wasted. If we squirt it all over the floor, we'll give you another one.
Yeah.
Well, because at that point, that's on you.
Exactly. Yeah. But if you take this home and you leave it on the counter, or you know, something happens.
I literally just ran and put it back in the fridge because I didn't want to leave it while we were recording sitting here.
That's on you, and it's not cheap.
No. Is it something that needs to be injected into like near or in the joint that is affected, or is it just given any like cushy spot kind of thing?
It's still a sub-Q injection.
Yeah,
you're not doing an intramuscular injection.
Under the skin injection, it's absorbed throughout the body, and that's one of the big benefits is that it can go to all of the joints.
Yes. An intramuscular injection, they're not going to let you do at home.
No.
Yeah, which I can't even. The vaccine, I guess.
Vaccines are so cute.
Well, I got nothing then. Like, what's even intramuscular anymore? Apparently, we just have intramuscular injections so that we have pain.
Our vaccines are sub-Q in animals, mostly because it's more painful. And I mean sedatives and stuff. The intramuscular injections absorb faster,
Mm-hmm.
so if you need it to work a little bit faster, you give it.
Yeah, but they're not going to send that home with you.
Interesting.
It scared the bejeebus out of me. And we have those cats coming in for boosters that I was like, I should just leave. I can do them. And then I realized it's the same amount of driving, so what the fuck do I care? Like, I'd still have to go out there, get them, and go there, and then, like, it would be the same loop. And I was like, never mind. I'm not taking that risk when it's the same amount of driving.
I mean, a lot of our, a lot of dog people don't want to give vaccines. Your dog is like wiggly and whatever else. Cat people are a lot more resistant to bring their cats to the vet every month.
Well, that's these cats. That cat is going to make my car disgusting.
But the thing with the old cats getting silencia is it really gives us a great opportunity to monitor their overall health. We weigh them every time. You know, we can, check out other things, like if they're, if they're not grooming very well, they need their nails cut, like exit. Yeah. Especially because these are our crunchy old pets.
Yeah. It's honestly the same thing for grooming, right? I'm like, we weigh them every time, we check them every time. Like it's important. And one of my staff just wrote, we haven't seen you in a while, sort of like automated message. And they sent it to me. And it was actually really beautiful. It was very fluffy and cute and like really lovely. And then I went in there and went, grooming is not lovely and fluffy. It is health related. And I like harshed the shit out of her like really beautiful message. Cause it's important, right? Like we keep it, especially the seniors, like when they're coming in for grooming, we're watching their weight every time. And when they're like, oh, they're down like a couple pounds, like you might want to check on that, or you need to add more food to their diet or whatever it is, because it happens really quickly. And when it's in your own house, you don't always see it. Right? Like
I don't see it. Haired animals.
Oh yeah. They wet those things down and they're like, oh my God, you're skin and bones. We tried that with Squid. She's just fat.
She's not skin and bones?
No.
She's not extra fluffy?
They do. My girls bathe our cats all the time. Well, not all the time because you shouldn't bathe them all the time. But like when they need it, they do it. They don't do regular cat grooming because they're not certified and that makes them really anxious. But they do our cats because, well, our cats wander back there and ask for it. So if you're going to keep going back there, you're going to get what you get.
But I feel like this is a good segue into what we're going to talk about next. Are we going to talk about?
I think I want
like having a good relationship with your vet.
Yeah, I think Ashley brought that up earlier, and I think it's really important. Yeah,
I feel really strongly about this. I I have noticed in my carefully curated Facebook feed of crochet recipes and rescue that in my local PEI groups, there's been a marked increase in people chasing the lowest price for vet care or clinic hopping, I'm going to call it, because they heard, I don't know, that A clinic gave great dental prices, but B clinic was the place to go to get spayed or neutered kind of thing. And it just really bothers me. I'm someone who has had the most amazing relationship with my vet med team for the boys. And I think that's because it's been so consistent and it's got longevity to the point where, like, I call the clinic to renew Remy's meds and they're like, how's he doing? Like, has he put any weight on since the last time he was in? Because he was down 7 pounds from the visit before. Like, if something happened to Remy and I couldn't get into, like, the Emerge quick enough because I live quite far from it, I know I could call my clinic and they would, like, help me out on the phone. And I feel like when you're clinic hopping, you're not going to have that kind of access to, like, the behind the scenes with your veterinarian, like that above and beyond they do for the clients that they have those awesome relationships with.
I'll say too, sometimes they can't do anything, right? You're on your way to Emerge. There's nothing they can do over the phone. But that phone call to be like, you're going to be okay. They're going to do these things.
Yeah.
Sometimes all you need in that moment is just somebody in the industry who knows what's going to happen to give you that inside information, right? Like, at this point, we're experienced enough that we know what's coming. But, like, for the people who are not, and you go to Emerge and you don't know what's coming, that reassuring phone call is sometimes gold.
Yeah. 100%.
But you're not going to get that if you call up your clinic and they don't even remember who you are.
Yeah.
Because you haven't been there in 3 years. They're not, like, you're not going to get it.
Yeah. And I just feel like because, I mean, here on PEI, at least, I think, there's been, like, a huge increase in new pet owners. Lots of puppies on the island, lots of kittens.
That's across the country. I think that's everywhere.
And it's just like, I just value my relationship with my vet so much. I feel bad for people that don't have it. And even if you're not getting any perks, like the extra, hey, how's Remy? Like, he lost 7 pounds at the last visit. How's weight gain going kind of thing. Your vet knows and has access to your pet's medical history. It's at their fingertips. So, like, they know more. They have the context. I don't know. I just feel like people need to stop with the clinic hopping.
I agree.
I mean, I think right now there's a bit of a product of the current economy. The role there is that,
doesn't our college set like a fee guide?
It's suggested.
So they don't have to follow it.
But honestly,
like
are pet parents really willing to save $75 off a spay by driving 4.5 hours to a different?
Not with gas prices the way they are now.
That's not saving any money in the long run.
No, and exactly like what you just said is that you're probably getting good care at that other clinic, but you're not getting continuity of care.
Yeah.
Good way to say that, yeah.
And you should trust the people that you're getting that advice from. I mean, even if it just comes down to the money, I mean, it's not an insignificant part of your budget to take care of your pet.
No. Even with insurance, you still have to pay exam fees and taxes, and it's not an insignificant amount.
And yeah, like all of these things, right? You're like grooming and food, like nutrition and grooming and pet care and pet supplies and pet healthcare is like, it's part of the budget when you get a pet, or at least it should be. Yeah. I'm covered in white hair.
Oh,
white, this black shirt.
I have tried everything that girl just sheds. And if you get the Zoom groom out and try to brush her, she will eat you. No joke. I left that thing on the table in between my couches one day, and she tried to eat it. I came down to her and she was in the kitchen running away from me with it because she's like, I will kill this thing. It's just a rubber brush. But to her, it was the devil. You know what? We have a good example of this too. I was away. I was traveling. And so was my husband, not with me. We were traveling separately, not because something happened, but because he had a conference and I also had a conference, actually. And somebody was staying here with my pets, of course. And a fight broke out between my littlest and that pesky bulldog. And of course, my littlest lost because he is 4 pounds and she is 25 pounds. And I couldn't, because I was away, my person who was staying couldn't get them into my regular veterinarian. So because I needed them to be seen. Otherwise I was going to probably have an aneurysm myself. Even though they were probably fine. And I knew this logically, it didn't matter. I needed them to be seen. And anyways, I was very fortunate that they could get them into your clinic. And the entire time I was still like, I texted my vet that night being like, FYI, this is happening. And, you know, I can get them in to see Dr. Leah, but like, I can't get them to see you just because of the way the like timing worked and all that other stuff. And he was like, okay, cool. Just like keep me posted. Like, let me know if she needs anything or if she needs me to pick them up. Like he offered to come get them from your clinic. I don't know and take them where because he lives past you. So like home, I guess he was going to take them to his house. I'm not really sure what the plan was. It was a very kind offer, but I asked 0 further questions because at the time my assistant came and picked them up. But that was an example where like we know each other. So there was an element of, you know, ongoing whatever, but I still kept my vet in the loop because he needs to know that like this happened. And, you know, because if I go in 6 weeks from now and something, I don't know, there's a subdural hematoma that hasn't gone away, he's going to be like, well, when did this happen? And I'll be like, well, now we know this is in the history of their care that something happened, right? So probably not that wouldn't show up 6 weeks later, but you know what I mean. Maybe it would. I don't know. Would it?
But I mean, if you think that the place that you're going for vet care only is trying to get more money out of you,
well, you clearly don't trust
then you
them.
don't trust them.
Yeah.
And that's a different issue.
You know what, though? We see this frequently now with certain corporate clinics where this becomes a pretty common thing. And I can't say for certain that it's because of corporate policy because I don't see any of those corporate clinics, but is it? Or is that just the gold standard of care and people just aren't used to clinics coming out the gate with gold standard of care? Like, is that not normal?
Well, I mean, I think even in those clinics, you have to, you know, they have to have an element of trust, and you have to be honest. It goes back to our other conversation is about being honest. You know, I feel like, I mean, again, I'm going to speak from my own experience, but if somebody says to me, like, you know, I would really like to get this dentistry done on my dog, but I can only afford, you know, this much money. And I'll be like, okay, you know, here's a plan we can make together. You know, here's what maybe we should do some antibiotics for a period of time. And then, you know, you could, you know, whatever, we can work in your budget. We can, you know, tailor things. We can do things in a stepwise fashion. There's a lot of different things that can be done if you're honest.
Yeah.
And I think people get ashamed to tell their veterinarians they can't afford things. But you know what? They hear it every day. It's okay. Just tell them.
Yeah, and it's not even honest about the money sometimes. Sometimes it's, I mean, every single time I dispense a medication for a cat, I ask, do you think you can give this to your cat twice a day? Can you physically give this medication to your cat twice a day? Because it's not easy. It's not easy. And if you have a cat getting more than one medication, it becomes exponentially harder.
We just had this. Didn't I tell you about this? We got called because the cat had Giardia.
LaGuardia.
AKA LaGuardia, which is just as terrible if you've ever been stuck there. Because there's no food in that terminal either. It's terrible. It's terrible. Anyways, the cat had Giardia, and what they didn't tell us till we got there and it tried to kill Richard was that it was also feral. Did they give me any sedative drugs? No, they did not. So Richard had to go in and they couldn't medicate their own cat. So they called the clinic, and this clinic recommended my company, which is lovely. And if you're listening, thank you. But also next time, please also send me with sedatives. It's a fair, reasonable request. They didn't want to do it in clinic. Just saying. Was that maybe why? I don't know. Anyways, whatever. They were like, don't worry, Dayna's Pet Services can handle it. We, for the record, did handle it. But not without risking Richard's life twice a day for 2 separate weeks. Because those are urgent, right? You can't be like, oh, well, we'll onboard you and like services start in 2 weeks. It's like, we onboard you today, you sign a contract today, we'll show up tonight. They're like urgent calls because you can't not medicate the cat. But this is an issue, right? Where these people could not medicate their own cat. And they got lucky that they had a service like ours that is trained with safety protocols and multiple plans at the yin yang for how to do this.
But I mean, they make medications for cats in literally 100 different formats.
This was liquid.
Yeah, but I mean, do you want it to be transdermal through the skin? Oral transmucosal, so like in the cheek.
Can you do a Giardia medication transdermal?
No. No.
So we were screwed either way on that one.
Like,
sticking anybody's fingers in that cat's mouth. That was not happening.
Sometimes tablets are easier. It's like you can get multiple medications compounded into one gel cap.
Okay, that might have been better.
Things injectable medications for cats.
Oh,
really a lot easier.
Richard came home that first Giardia visit, and he walked through the door, and I'm like, what do you smell like? Like, because he smelled like something died in his lap. 'Twas cat. Like, I was like, get in the shower. Like, do not come anywhere near me. Like, it was disgusting.
But they make cat liquid medications flavored in like you don't even. Anyways, the other situation where it happens all the time is ear meds.
Mm. Don't they make Felomazole now for the ear? That's what we do a lot. Yeah. We do a lot in the ear.
The ear meds for dogs. People are not honest about that.
Oh, that they can't get the ear meds in.
They can't get the ear meds in. They can't clean the dog's ears. They don't know what they're doing.
Well, it's hard because you can't see either, right? Like when you put that flat back down and massage in, you can't see. People don't know what to listen for. Yeah.
Right?
Because you're pushing on that infected, swollen ear canal.
You're afraid to like put the medication in there and squirt it.
Because that canal goes further in than you think it does.
Yeah.
It's not like ours where it stops like here.
There's no point in me giving you the tube of ear meds if you can't get it in.
So I've heard of clinics now who will do the first dose instead of the tech doing it, having the human do it. Like having the client administer the first dose in clinic, supervised to depending on the drug, because sometimes you can't do that. But so that you can determine whether or not they're going to have the capabilities of doing this for the next 10 days or whatever it is.
Clinic did this. The first time I moved home and Remy had an ear infection, I went in and they prescribed Suralan, and Dr. Goff was like, look, this is the first time I've seen you. I'm sure you're capable, but I'd like to see you dispense the medication just so I know.
I'm sure you're capable, but prove it.
And I was like,
receipts or bust.
No problem. Let me show off Remy sitting rock solid, waiting for his eardrops. Like, he does not give a frig about getting eardrops. And Dr. Goff was like, I appreciate that. And that was the start of my amazing relationship with her.
Yeah. Eardrops I can do. No problem. Injections, I make Richard do it.
Plenty of dogs that you just can't get. People can't do it. But I mean, it's again, and where the other big thing where this comes up, Dayna in particular, is nutrition.
Mm-hmm.
Right? Be honest with what you're feeding your pet and what you can and can't do. Right?
Yeah.
Right? And it goes back to our nutrition episode again about if you really want to feed raw food, there's some serious dedication and information that you need to know to have. to be able to do that properly. And you need to just be honest.
You know what? And I will say, like, and I talked about this more in the nutrition episode, so please go listen to it. But and I just said this to a client the other day. She came in my doors. It's the week before Christmas. She's buying a sweater, which I love. Buy sweaters for your dogs. I have a higher margin in those than anything else. And I was like, oh, can we get you anything else today? Like, are you set for food for the holidays? Because don't forget, we'll be closed for a couple days. Which is something we asked everybody, right? Like, we're going to be closed. I'm not coming in on Christmas Day because you forgot to buy your food today. Like, are you good? And she's like, oh, I home cook. And my mom was talking to her and I heard, oh, I home cook. And all she saw was the door to my office and me go, because I'm like, what do you mean you home cook? And I started asking like 45. She's the only person that has ever walked through my door that I went, if there was a hall of fame of clients, you would be on it. You'd be on this wall of fame. He did it again. He just booped the fireplace. Son of a bitch. He just did it again. Anyways, but yes, in nutrition all the time. And like, so I have learned over the years to read between the lines. Because clients think they understand, especially with raw feeding, what is required, and they don't. But even my weight loss programs, I write my weight loss programs with the clients in mind. And I remember the first one I wrote after I graduated, I was showing it to Dom. I don't know, like, I don't work in vet med. Like, what if she sent this to her vet the next day? I was kind of freaking out and I was really nervous because it was my first one by myself without my professor. I was on my own. And it was a weight loss plan because this dog was rotund. And I wrote it as a 6-month weight loss plan. And I gradually decreased calories every week. And I showed it to Dom, and her first question was, why didn't you just decrease to ideal as of today? And I said, well, that's actually on the behavior side, right? Because the dog's going to be begging for food. They're going to be kind of a jerk about it. And the humans are going to cave. The human did it again. It was a bubble.
I don't know why I'm stopping it.
Is it my hands?
I don't know.
Anyways, people listening to this are going to be like, what the hell are you talking about? There was a bubble. Did you all see it? There was bubbles. But yeah, it's the humans, right? They're going to cave and go, I have to give them my biscuit and gravy because look at how hungry they are. But if we do it in this really gradual way with the human in mind, can you do this? Because your dog can do it. I could have decreased the dog's calories that day, halved their dinner, and they would have been annoyed, but they would have been health-wise fine. But it's, can the human do it? Can the human being manage to work with the dog through this process? Because yeah, the dog's gonna be like, bitch, I'm hungry, give me my fucking food. Like, and I don't blame them, they're starving. They've been fed this double the calorie amount of food for this whole time, and now we're saying to you, no, you can't have that. So if we decrease it really, really gradually, they're less likely to fail. The people, I mean.
Yeah, no, and it yeah, like I said, it comes down to, again, I almost forgot that when we talked about nutrition, we talked about the kickbacks.
Those actually look like some nice socks.
And I brought my Hill socks.
Oh my gosh.
Today.
Those look pretty cozy.
Because this is like the one and only, and I actually won these as a prize at some
trivia night.
Yeah, I think it was curling actually.
Oh, God, I don't know how to do that.
But yeah, it goes back to like, this is the kind of kickback that I'm getting from recommending prescription Hills food.
They're nice socks, but they're not that nice.
In reality, the kickback that I'm getting is, you and your dog and a better quality of life and longevity. And I mean, for me, I say this all the time at this point in my career. And, when I'm talking to like young veterinarians and vet students and stuff, I say like, what I get out of this career at this point is the relationship with the people and their pets. Right?
You're nicer than me. I just want the relationship with the people's pets, not the people.
But it's the people and their pets, and it's their, the different ways that people, have pets in their families, and the way that they interact with their pets, and that's really what it's all about. That's what we're getting out of helping you care for your pet. It's certainly
Not the
Not the
socks.
socks.
So I think for me, that is the most perfect segue into how to start 2025 off right.
Mm.
Would recommend a cozy pair of socks, for the record. I am pro cozy pair of socks.
They're very cozy socks. I really I only wear them to bed when it's really cold.
That's what I said. These are like bedtime socks.
Yeah, they are.
Yeah. What? That's the kind of socks I would wear to go to bed when it's like minus 40 outside and your bones are cold.
I call those reading socks because I'll only wear them in the evening when I'm reading, and then I have to take them off for bed.
I think they technically actually are called reading socks. I'm pretty sure. Like, that is a type of sock. But I like to call them bedtime socks because who has time to read books? You're better at disconnecting than I am.
Yeah.
Hi.
Me too. I just
Yeah. Me too. Although recently I've been making Richard carry my weighted blanket around the house.
I only have time to read because I don't have a husband.
That's the ticket to life.
That's
it.
That's why I can meet my Goodreads reading goal every year. It's because
How many books did you read in 2024?
Like 118.
That's stupid.
That's
Not?
That's insanity.
That's beautiful, girl.
I read 3 whole textbooks.
I didn't read any textbooks.
There's probably some sort of equivalent to like fun reading to textbook. There's like a Google calculator.
There probably is.
So maybe I'm at like 50. Well, maybe not.
It works.
25.
Sure.
I
We'll
say
round
25.
We'll round
It
up.
was dense. It was a dense textbook. And now I have to read another one. Because apparently there's a new one now. Anyways, that was not the point of this. 2025, I want to start it off right. I want to talk about enrichment because it's winter where we are. Well, actually today it's above 0, so it's actually not that bad. But if you have a dog that's averse to the cold or to the wet, because it is no matter what you do now wet out there, what are we doing to provide them with enrichment, right? Because that's really important. And I know, as Leah has said, I don't know how many times, we love with food. So how can we use that food to provide our dogs with enrichment without adding calories? Because you should actually be reducing calories with their lower activity levels. But keep them entertained and keep them happy. And I have to say, I'll tag my favorite products somehow. I don't know. I'll figure that out when I'm pretend
in the
editing.
show notes. Is
Yeah.
that what we say?
Yes.
In the show notes.
Put it somewhere. Some of my favorite products that I use for enrichment for my dogs, as well as some that I highly recommend for my kibble feeding clients, that you don't actually have to add anything or do anything. It just changes the way you feed them and it keeps them entertained. And we talked about this a little bit before, but the snuffle mats is one of my favorites.
Yeah.
You literally just put the kibble in the snuffle mat and then give it to your dog. It's easy, but it'll keep them entertained forever. And snuffle mats do come with different levels of difficulty. So if you've got a really smart dog that's going to figure it out really quickly, there are higher difficulty snuffle mats, and I recommend them really highly because they're not adding anything to their diet. You're not changing anything. You're just changing the way they feed. They're easy to wash. Toss them in the washing machine alone. I wouldn't put them with anything else, just, because dog stuff. But it's easy, super easy. And it's one of my favorites. And brain games. Ashley, you're a big fan of brain games.
I am. My current favorite is I bought an old muffin tin at Value Village, and I hide kibbles, or in Remy's case, pieces of apple in some of the cups, and then I cover them with tennis balls. All of them get covered with tennis balls, and then he has to nose away the tennis ball to get the treat.
Love it. You can do that. Make it harder. Make them ice cubes in the summer.
Yes, we do frozen ice cubes.
Yep.
Frozen apple in ice cubes.
Yeah. Or if you have a dog that's not allergic to life itself, you can also do it with bone broth.
Yes. We also, we play a lot of hide and go seek in my house. So I'll put the boys, they know their place command. So we'll do place at the back door, and then I'll run and hide pieces of apple or broccoli or cucumber or treats or whatever it is I'm using that day in the den. and then they know the find command, so they'll come running in and they'll sniff out all the treats and find them that way.
Scenting, love it.
That's a good one.
If you don't want to add calories, you can also do that with you. So like put them in their place command, you run and hide somewhere,
Yes.
call them to find you.
It's harder to do that with Nigel because he's deaf, so he'll never hear him.
True.
Oh,
It's funny because in my house it's easier to do that because I have 7 dogs and I don't want to risk a dog fight over they all found the same piece of cucumber at the same time. So
that's fair.
adjust for your situation.
Yes.
The other one I like a lot if you're a kibble feeder is Orbeez. Not those weird little bubble things that you
Oh
put
yes,
in
the
the
little cuppy thing.
but they're like a little silicone inverted mushroom. So you pop out the center, you put all the kibbles in the center, pop it back down, and then give it to your dog for their kibble dinner. And because it's silicone, they can throw it all over your house all they want to. Well, they might break a vase, but they're not going to like damage your floor because it's soft.
Way better than the Kong wobbler.
Yeah. If you have a dog that's going to pick it up and throw it, way better for your floors.
Learn
than
that
the
lesson the
wobblers.
hard way.
Yeah. I have dented some floors with the wobblers in my years.
There's definitely a hole in my Gatineau apartment in the wall in the spare room from Remy throwing the
Sorry,
Kong wobbler.
landlord.
Sorry, Sharon.
Yeah. But yeah, those are some of my favorites that I highly recommend when you're thinking to yourself, oh, New Year's resolution, I should go to the gym. Your dog also needs enrichment in January and will get bored and you might see increased behaviors of things you don't like, scratching, digging, chewing on baseboards, because they're bored. Because you probably walk that dog all summer and now in the wintertime it's sitting there just bored out of its treat. Give it things to do. Also, if I hear one more person come into my store and tell me they want stuffed toys that last, fucking stop it. They are designed to be destroyed. That is their purpose. They are literally meant for dogs to rip them apart. They are designed to serve an innate need to have prey. That is their purpose. So when you come in and say, I want a stuffed toy that's going to not be destroyed in 20 minutes, no one can help you. That is not a thing that exists. They're designed for destruction. I have some toys that are designed for destruction in different purposes, so we could talk about that. But if you want a toy that's just designed to be chewed on all day and not get destroyed, you can have a Kong. You can have the new Earth-rated toy, or maybe a Chuck It, the hardball, not the tennis ball one. But like that's it. Like otherwise, stuffed toys are designed for destruction for a reason, a good reason. So yeah, they are $20+ a toy. I don't make the prices. Don't yell at me. But I'm also bringing you ones that are safe, so that if your dog does destroy it, they are safe. It's fine.
They don't have beans and eyeballs like just teddy bears.
They don't have beans and eyeballs. And let me tell you, as someone whose mother had a dog who once swallowed one of those like child's toys eyeball things, it nearly perforated his intestine. It was a
recall on some stuffed toy that was marketed around Christmas for kids because the eyeballs are coming off.
Because children will also choke on eyeballs.
Ooh.
Or probably the beans inside those Beanie Babies. Although I don't know why a child would eat those, but some children
stick them up their noses and in their ears.
That's weird.
Can one of the start 2025 things off right be don't take your dog to the dog park?
Or at the bare minimum, don't listen to the guy at the dog park.
Or
No,
that.
Go.
I'm also on board with don't go, but like, if you're stupid enough to still go, the guy at the dog park doesn't know anything. Do you want to know how I know this? Without even knowing who the guy at the dog park was. He's at the dog park. Which immediately means he knows nothing.
There are just so many other options in the dog park. Like, just don't go to
Name me one veterinarian. I was going to say vet tech, but no, I know too many dumb ones. One veterinarian. One responsible, educated dog trainer. Certified dog trainer who goes to the public dog park. Not a one. Do you want to know why? They're terrible. Forget the fact that the guy at the dog park doesn't know fucking shit, yet he's going to tell you he knows everything from everything, and probably has also got his medical degree from Google MD. They're a cesspool of disease. You want your dog to get worms? That's where your dog's
Yeah.
getting.
That's where you
Look
get
it up.
LaGuardia.
That is where you get
That is
LaGuardia.
where you get LaGuardia.
Look it up. The dog park study. The dog park study is very eye-opening.
So gross. Oh my god, and leptospirosis is on the rise. It was on the rise all fall. I know personally people whose dogs got lepto this year. Dog parks. Dog parks are full of still water. Disgusting puddles. Disease-ridden puddles.
That's another good point for 2025 is that the AVMA? I don't know. Somebody
of true authority.
I think it was the AVMA, made leptospirosis a core vaccination.
Yes. No, I think that was here. I think it was our CVMA did that. Because I saw
Maybe
that.
AVMA and CVMA in the US too.
They might have been in cahoots.
Yes, in cahoots.
Yeah. So the CVMA being the Canadian Veterinary Medical Association.
But yeah, they have like formally recommended. So that is all dogs, irregardless of lifestyle factors, size, breed, whatever excuse you want to use, should be vaccinated against lepto.
Well, and
because it's a human health risk.
Well,
And
and
there's enough prevalence in North America.
my regular veterinarian for my dogs got leptospirosis in vet school. Still has some vocal paralysis because of it. But what I was going to say is I also know there were cases in Ottawa specifically this past year where dogs had not been to dog parks, had just been like traipsing through puddles because dogs like to play in puddles. And then they go home and lick their feet. Lepto. I shit you not, I once tackled a bulldog out of a puddle. Richard made fun of me for weeks, and I was like, there will not be lepto in this house. It was Gilly, in case anyone was wondering. Frenchie is a very clean bulldog. She's like, I am not touching that disgusting water. Gilly, on the other hand, is like, I love gross, muddy water. Because he's an ass.
He's got boy brain.
And the problem is he's brindle, so you can't even tell how disgustingly muddy he is until you get home and it's all over your white sheets.
Learned that lesson the hard way, did you?
Yeah, I did. Because I got him in February. The spring came and I was like, oh, so you're disgusting. Fun. That's awesome. That's when I also went, were white sheets a terrible choice for a doghouse with this many dogs?
Terrible.
So terrible. Well, what I learned was if you just buy 3 sets of white sheets and change them all the time, it always looks clean. Hacks. But yeah, no dog parks. Stop listening to the guy at the dog park because he's a fucking idiot. That is a true clinical professional opinion, just for the record. He is. And if I have to hear one more time my breeder said, your breeder doesn't know shit about shit. You're lucky if they know something about genetics. They don't know. They do not know more than your certified behavior consultant. They don't know more than your veterinarian. And they certainly do not know more than me. So stop coming into my store and telling me they know things, because they don't.
They've been breeding dogs for 25 years.
Great. Well, who knows? Because they're breeding doodles, so they obviously fucking suck. I just had a lady bring in her 8-week-old doodle puppy, just the beginning of December, into my store. And she had it on the floor. And I'm like, I'm going to need you to pick up your puppy. And she's like, oh, no, I have to socialize it. I said, oh, no, I don't want it to die. So please pick up your puppy. And she's like, well, there's no other dogs in here. It's safe. And I said, while I hope that every dog that has walked through these doors has been well vaccinated and is not ill and is not bringing disease, I can't promise that. And there is not a chance in hell that this dog has also had all 3 sets of vaccinations. And she's like, no, she hasn't had any yet because she's so small. Smiling at me. And I'm like, I'm going to need you to pick up your puppy. And then I said, how old is it? And she said, 8 weeks. I said, okay, what breeder did it come from? Because the law is 10 weeks. And she told me, you all know who it is. And I'm not going to tell you who it was on the podcast because they will sue because they're crazy. I'll tell you. And I said, okay, great. So I will let them know. I'm going to be sending them a message to let them know that they're in violation of the law. Maybe they don't know. It just came out. But moving forward, they need to keep their dogs for 10 weeks and they need to provide the first set of vaccinations. And she said, no, this is a great breeder. She would never violate the rules. And I'm like, well, she's breeding doodles. So like, she is.
Red flag right
and
there.
she let it go at 8 weeks. And so she did. And she didn't vaccinate them. So again, she did. Anyways, we talked for a while, and then she said, well, I have to socialize the puppy. I have to bring it everywhere and let it walk around and do whatever it wants because that's what the breeder told me I have to do. And I'm like, well, that's not what socialization means. And without vaccinations, you're quite literally risking this dog's life. So please no, because I do not want that on my conscience. So she eventually did pick up the puppy. But then this very large, very friendly, possibly sheepadoodle, I couldn't tell because it was shaved down, or sheep or something, came in. It was pictures with Santa Day. And so this very friendly, very happy, you know when they're kind of fat and they have like a mushroom butt? Where it's kind of like love handles, like a mushroom butt.
I call it the English sheepdog butt.
Yeah. He had a little fat mushroom butt. And anyways, I liked it. I patted it a bunch. Well, I didn't like it because it was fat, but she didn't want to hear about my weight loss plans. Anyways, but I patted it anyways because it was very happy and friendly. But this dog kept coming over and wanting to see the cute puppy. And this puppy was doing all the things to tell us it did not want to do this. And so I said to the lady, I said, this puppy's very uncomfortable. You want to know what socialization means? This puppy's telling you, I don't want to do this. And so you as the owner need to go, okay, I hear you. Go away, other large dog. That is socialization. Boundaries are important. And she just looked at me and she goes, well, then he's going to be scared of dogs. I'm like,
No.
So I literally just went, I'm going to go. And I went back to my office, and that was the end of it. She still stayed in the store for like 20 more minutes doing fucking nothing.
Door to your office.
I did. Well, she was at the front of the store, like kind of like right in front of the doors. So like my office is all the way at the back of the store. So really, like, she didn't wander. You know what it is? Puppy care is something I'm very passionate about. First of all, I love puppies. I don't know how many people who work in this industry that actually really dislike working with puppies. Probably because they bite you and sometimes pee on you. But I think they're very cute, and I like them, and I love puppy breath, and I love everything about them, and I love working with them, and I love doing puppy boot camp, and I love all of it. And I feel very passionately about puppy wellness consultations. And I don't mean on the vet med side, although that is also very important. Please spend the time to do happy visits with your puppy. Give them to the clinic. Let them love them. Give them cookies and leave. Do you have any idea how much easier that will make your life when you're just driving past the clinic anyways? Pop in. Hey guys, can you just love my puppy for a few minutes?
Have a good relationship with your vet clinic.
They're never going to be like, no, we don't have time for your very cute puppy.
Like your puppy.
They will never say that.
Right in our day.
Yeah. They will not be like, go away, cute puppy. They're never going to do that. They will be so happy that you made their day with your cute puppy, and they will love it and kiss it and give it things, and then you can leave. And it didn't have no vaccinations, no shots, nobody poked it, nobody took its temperature in an aggressive way. It's just easy. Do it now, all of your puppies. But then on top of that, take the puppy obedience classes are important. They do good things. They do some socialization. They teach you basic things, but they're not really going to talk about the behaviors of puppies. So when you go to a puppy obedience class, we don't talk about how to get your dog to stop jumping on people. We don't talk about crate training. We don't talk about isolation training because that's separate. We don't talk about some of the manners that you want your dog to grow up in. And we certainly don't talk about what you're going to expect as your dog goes through the additional fear periods that it's going to go through, as well as the developmental stages that it's going to go through, because those things are going to change. And that super cute puppy obedience thing where it did all the things and it sat when you told it to, it's going to become a teenager and go, fuck you, I'm not doing it. And you need to start all over again. If you've parented human children, you'll recall that's what they did around 12 or 13 years old. Maybe 14 if you were lucky. You could probably attest to that. How many teenagers do you have now? They're they're teenagers. They're awful. Nobody likes them, and you just have to write it out. And that's very similar to dogs. However, you have to also provide a significant amount of structure if you don't want those bad habits to continue into adulthood. Puppy obedience doesn't do that. I recommend you do both. You hire someone like me who comes in and does a one-on-one consult with just you. We get to talk to you about who your puppy is, what they are, what to expect. We're going to talk about their breed expectations, what you can do to prevent some of these things that as a breed they might be kind of more naturally prone to. There are going to be things you don't want, how to predict these. We're going to do all of that. But then you're also going to go to puppy obedience class where they're going to teach you how to tell your puppy to sit, lay down, and stay. And you're going to do that in a room full of other puppies where they can play after in a socialized but structured and supervised place. It's important. Puppy wellness is critical. But if I hear one more person tell me that their breeder told them that socialization means they just need to take that puppy and shove it in everybody's faces and hope for the best, that is not what socialization means. It isn't. It hasn't been in a very long time, and that breeder should stay in their freaking lane. And by their lane, I mean like probably the job they had before they quit and made their puppies their sole source of income unethically.
I don't know that we can call those people breeders so much as greeters.
I like it. But yeah, I can't, right? Breeders who breed for hobby breed as a hobby. They're not making that much money off their puppies, if anything. Because that health testing, pretty penny, let me tell you. I looked it up once. It is expensive. And if they're like, oh, it's cheaper because we use Embark. Embark is fine. It's just not proven, and it's not public. So if you have a dog whose breeder uses OFA health testing, you could go to the OFA website, type in your sire and your dam, and you will get the results publicly. Your breeder can't fake those for you. They are available to anybody at any time to look up. You just have to have the mom and the dad of your dog. Embark? Anyone with a Canva account can just make an Embark account and like bloop, 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 document. Just saying. And there's no proof. You have no way to verify.
It's
They
fun.
have health testing now. It's just not. It's new. It's too new. And it's not the same. And they don't have all the same panels either that you can run that OFA
There's
does.
no, like, DNA marker for hip dysplasia. It's too complicated.
Well, just assume if you have a German Shepherd, you are going to have hip dysplasia. But also, do you have any idea how many German Shepherd breeders I have vetted over the years? Because clients will call me and say, is this a good breeder? Although they never listen when I say no. So like, why? But whatever. And about 4 out of 5 times that I vetted German Shepherd breeders, I don't even get past the first page without being like, nope, all the red flags are right here. I don't even have to go any further. Done. Like, just no.
So for 2025, we're gonna research our breeders.
I'm too angry now to be happy about 2025. I'm just so mad.
I'm so sorry.
We're gonna research and
And listen to our professionals.
listen to our professionals. And we're gonna form good relationships
With our professionals.
with the animal professionals.
Yeah.
They need it, okay? They need it. Or you're going to have fewer professionals in 2026, okay? We need you to, like, once in a while listen to us so that we can go, oh my God, it worked. And ride that high for 8 to 10 months. I can't now. I'm so
I'm so
very mad. I'm physically warm. I am physically warm with rage. She did.
Cover dog.
There's no such thing as a cover dog. No.
My point was, no matter what fancy name you give it, it's always going to be a mutt,
It's always
a mixed breed.
No.
Just be real.
Just own it. And I swear to God, if you listen to your breeder that tells you that your doodle mix thing doesn't need grooming until it's over a year old, I'll smack you myself. Because it does. At 16 weeks old, you better be in my doors doing puppy's first grooming. And every 6 to 8 weeks after that. Not because it actually needs a ton of grooming at that age, but because by the time it's a year old, it's biting us and we're over it.
And come to the vet.
And go to the vet. Do your happy visits at your vet and do your happy visits at your groomer. Both are great. We're never mad about people handing us puppies. We are thrilled.
And work with your puppies at home. Play with their feet and their ears and like get them used to being manipulated and like restrained. It's not rocket science, people.
We're back. Sorry. We had a really weird technical problem. And if anybody asks, we're going to blame Richard. Yeah. Anyways, we're back now. And on that note, we're going to wrap it up. So 2025 bucket list. We're going to listen to our veterinary professionals. We're going to listen to our behavior professionals. We are not going to listen to our breeders. They are professionals of nothing. We're going to provide our pets some enrichment because it's winter and it's dreary and disgusting outside and we're all depressed and bored. So instead of drowning our feelings in food and their feelings in food, we're going to find things to occupy our brains because that's important for us and for them. And you do get some enrichment out of doing fun things with your dog. You could also look up some cool stuff you could teach them. There's trick training titles you could get. It's called Do More With Your Dog, literally. Google it. And you can get all sorts of cool like titles and ribbons and stuff for your dog. Very cool. Do that.
And if you're looking for something for your cat, check out the Ohio State University's Indoor Cat Project. Some really good cat enrichment stuff on there.
Cats also need enrichment. I would actually argue they might be even more finicky about that than our dogs are.
Especially because they don't go outside at all. Or shouldn't.
They shouldn't be outside at all. Getting bird flu. Just saying. Just saying. So I think that's it for me, unless anyone else has anything. Oh, and be nice to your veterinarians. I say it every podcast episode, but I'm going to say it again. Be nice to your freaking vets.
That'll be your new like Bob Barker line.
Oh, yeah. Spay and neuter your pets and stop being a dick to your vet.